November is National Diabetes Awareness Month, and the folks from the Buckeye Health Plan want to help you understand the disease and hopefully prevent its spread.
Dr. Suprenant is here with more on this all too common health issue. It's great to have you back on the show here today, sir. I feel like a lot of people know what diabetes is. I think people get hung up on the type 1, type 2. Can you break that down for them?
Definitely. So diabetes is really conditions in which the pancreas either doesn't make enough insulin or your body doesn't respond to the insulin that it makes. So type 1 diabetics have more of the problem where they're not making insulin. And almost all type 1 diabetics would need to actually receive insulin. Type 2 diabetes is when your body does not respond to the insulin that you're making. And so some of those patients can be treated with other medications and some do need insulin.
Now, how is Buckeye Health Plan helping address the issue of diabetes?
Well, of course, by coming to events like this, but also we have a case management team that reaches out to our diabetics and works with them. So we send them letters, telephonic meetings, and then we even will meet with them in their home and help them manage their diabetes.
And for those that are most at risk, who would those people be?
Most at risk for getting diabetes are people who are overweight and sedentary and follow a poor diet.
Now, how many people are affected by diabetes, type 1 and 2?
It's huge. It's about 9.5% of the total population has diabetes, and that number is growing rapidly.
And taking a look at some symptoms of diabetes, I feel like the conversation about diabetes has, really been a lot more common lately in the last few years. Can you die from diabetes?
Yes, actually, it's one of the leading causes of death. It's considered the 7th leading cause of death.
Now, aside from those symptoms, how can a doctor diagnose it and detect that somebody does have diabetes?
It's really easy. So when you go to your doctor, particularly if you're at increased risk, such as being an older person, only over 45, and being overweight or obese, your doctor can do a simple blood test that can test you for it and make the diagnosis with simple blood testing.
How can people start being proactive now, whether it's for their kids or just their own personal lifestyle, to prevent diabetes in the first place?
There's a lot of great things that a person can do. Following a healthy diet, of course, maintaining a good body weight, regular exercise. Then they also recommend avoiding alcohol and tobacco, and then reducing stress in your life.
Now, I think a lot of people ask this too, is diabetes hereditary?
It does tend to run in families, so it's not directly hereditary, but it definitely tends to run in families, and if you have a family history, you would be at increased risk.
How difficult is it for someone who has diabetes to really just maintain, because it's something that you have, like clockwork, I mean, you have to check your blood every single day and so on and so forth. How difficult can that really be for someone?
It depends on the severity of diabetes and whether they're type 1 or type 2. So for very young type 1 diabetics, it can be really an around-the-clock job for even their parents as well as for the child. In adults who have type 2 diabetes, it may just be a matter of trying to follow a good diet and exercise program and taking oral medication as prescribed by your doctor.
Now, all month long, you guys will be focusing on this issue. And you mentioned event earlier. You guys going to be having some type of event?
Oh, I meant coming to visit with you guys.
Gotcha.
Oh.
Okay, just making sure. But
what is an event? Of course.
It is an event. It's an event when you come to visit Dr. Suprenant. So if anybody wants to get in contact with you guys, learn more about you, how could they do so?
BuckeyeHealthPlan.com is our website.
Okay, it sounds like the big takeaway here is, prevent it in the first place, live healthier lifestyles, be active, eat healthy, and, encourage your kids to do the same.
Exactly.
Thank you so much.
Thank you so much for your time. We do appreciate it.